Hello, I'm Emma Howard and I'm joined by Dr Su Laurent, who's a consultant paediatrician at Barnet Hospital in Hertfordshire. Hello, Sue.
Hello, Emma.
Got a question here about bedwetting. Lots of parents will be interested in this answer. This question's from the parent of a 5-year-old who's still wetting the bed. Should I be worried, they say, and what should I do?
I think the first thing to say is that it's very common for 5-year-olds to wet the bed. It's actually normal. And most treatments for bedwetting, we don't even start till a child is 7. Because it's such a common and normal thing. At this stage, the important thing is to make sure you're not giving your child lots of fizzy drinks, because caffeine makes them wee more. And if they wee more, particularly if having fizzy drinks later on, they're less likely to have bladder control at night. Make sure you're giving your child plenty of drinks during the day, because getting good bladder control during the day, being able to fill the bladder, empty it regularly, is going to be helpful for bladder control at night.
Sort of training it almost.
Training it. And don't penalise them for wetting the bed. It's not their fault.
Do you have a cut-off point? You know, no drinks after 6 o'clock or something like
that?
No,
usually that isn't a particularly good idea. It's usually best just to give them a normal drinking pattern as long as they're not giving caffeinated drinks to their children.
And any other advice apart from not penalising them? Because shaming is a really bad thing to do to
children. Shaming is a really bad thing to do because most of these children can't help it at all. Look to your own family, I would say. It's very common. If bedwetting in parents, you'll often find that parents have bedwet till they were quite old.
Although sometimes your own parents can't remember what you did as a child.
They can't remember or they've never told you.
Yes.
But it is quite interesting. And it is slightly commoner in boys than girls.
Because I've seen those pants in the supermarket for children to wear protective pants at night, and for boys they go up to the age of sort of 7 to 9. It's really nice to see it there so that everyone knows it's quite a common problem.
It is a very common problem.
Yeah, and for girls too, I know, but often more so for boys.
Exactly, yes.
Now there is a website and a helpline people can contact,
and I think this should be the first port of call for everybody. It's called the Enuresis Resource and Information Centre, or ERIC for short.
Yeah, ERIC's easier to remember.
ERIC, exactly. So go to their website, or you'll get their number as well. They'll send you information, and I find it very helpful.
Great advice, Sue. Thank you very much. And if you have a similar problem, we hope we might have given you some help. But remember, it's always best to go and see your own doctor for medical advice. Thanks for watching. We'll be back with more health questions and answers.